Thanks, Paul. I'd like to welcome everybody to the September 20th, 2022 Ashland Board of Health meeting. Just a quick disclaimer, this agenda is subject to change and includes those items reasonably anticipated by the chair to be discussed at the meeting. Not all agenda items may in fact be discussed, and other items not listed may also be brought up for discussion to the extent permitted by law. And with that, we will call the meeting to order at 6:03 p.m. And as always, the first agenda item is citizens' participation. Mark, what do you got for us this week?
I'm saying good evening, happy Tuesday, everybody. I'm going to surprise the whole board. I said it earlier to Rashida and Laura. I don't have anything tonight.
You're kidding.
Nope.
No. Mark Sony at a loss for words.
Well, not completely lost for words, but he's there, but he's going to stay on the air, but stay quiet.
Okay. Laura, make a special note of that's a first in the history of my Board of Health tenure.
It's on the record. Notes,
okay. All right. That's great. Thanks, Mark. I see our esteemed town manager here. Yeah. Anything you want to say?
Well, I think I was on the agenda for 6:05. I can certainly start if you want.
Okay. I don't.
Did you not get the revised agenda?
I probably didn't get the revised agenda, so go for it.
Oh, so yep. It's going to be a real surprise for you.
Okay.
So, well, the purposes for me coming before the board tonight are to talk about a newly implemented sewer moratorium that we put on. So the reason I'm bringing this up with the Board of Health is that the Board of Health actually has the ability to require properties to hook up to the sewer system. And obviously a sewer moratorium would prohibit new hookups. So that's why I'm here before you tonight and to talk a little bit about that and hopefully get your endorsement. So I will just give you a very broad overview of what led to this decision. We have a number of projects that are before the planning board right now, large multifamily projects. There's a couple of commercial projects. And one of the things we do when any of these projects come in is we look to evaluate its impact on the sewer infrastructure. And one of the things that we've seen is that while we feel like our current infrastructure can handle those projects that are before the planning board and the zoning board of appeals, the current projects before them, we're hearing rumblings of more projects coming before those two boards, and we can't really calculate the impact of those of future projects until we actually get the ones before the board permitted and online. So that is the reason for a sewer moratorium. A sewer moratorium gives us the opportunity to prohibit new sewer connections coming into our system with a couple of exceptions, and I'll go through those later. But it will give us time to evaluate our sewer system and evaluate some of the changes that we've made over the last year, as well as get more data and, again, make a better informed decision about what we can allow in terms of new hookups moving forward. So this moratorium would not apply to single family homes, and it would not apply to commercial properties. So really those two would be exceptions, I should say. That is a very, very general overview of this. I can get into a little bit more of the data if you'd like, or more of the explanation. But I'll keep it general right now and see if you have any questions.
Mike, I have a quick question. So Mike, is there a time frame that you're looking for?
6 months.
6 months. And you need a vote from our board?
I would like a vote from the board. I don't think it's necessarily required, but I think having your endorsement on this would go a long ways.
I'd like to make a motion that we support the town manager's moratorium for sewer hookups for up for 6 months, excluding single homes and commercial businesses.
Anybody like to second that?
I second it.
Okay, all in favor?
Aye.
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 Aye. Okay. That
Thank you.
looks like that that passes. Mike, so I'm just interested. So I mean, what type of what type of structures are you looking to put the moratorium on? So when you said single family homes and businesses, is that apartment complexes and things like that? I mean, if they're not hooked up to town water, I don't know how. I'm just trying to understand exactly what types of structures would be excluded for right now.
Well, I mean, so again, single family homes, not subdivisions, but single family homes and commercial properties would be exempt from this. What it would apply to is everything else. So, multifamily, like apartments, it would apply to that. It would apply to new subdivisions. Those are the two primary things that I'm thinking about that it would apply to.
Okay. So it means we would basically have to wait on building those until everything's evaluated, you're saying?
Correct.
Or allowing those.
Yeah. I should reiterate something I said earlier, but it might have got lost just because I was starting out. This doesn't apply to current cases before the planning board and the zoning board. So we've looked at the sewer system and feel like we have capacity for those. But again, Ashland is clearly becoming a more popular place to develop, and that can have pros and cons. Each of those developments can have pros and cons, but what we're concerned about right now is its impact on our sewer system. So thus we have a moratorium.
Yeah. Okay. And so and you may not be able to answer this. Are there, I'm assuming that at some point there's going to be further growth. So is there going to need to be some other, kind of type of capital expenditure, like with the safety department building, to upgrade our sewer systems to accommodate that, whether it's a new treatment plant or, so I thought we had a relatively new plant, or, I don't even know what goes into that.
Yeah, that's a good question. So, obviously the new projects and everything, the ones that are currently under construction, we feel confident that we can handle those. Let's talk about the constraints on the current sewer system. So we have essentially 3 constraints. 2 of them are what I refer to as paper constraints, because they're more bureaucratic in nature, and they're on paper. So for example, the first one is what's known as the interbasin transfer limit established by the DEP, which allows 3.2 million gallons of Ashland wastewater to be transported out and treated at the wastewater treatment facility at Deer Island and going into the harbor. So that's why they call it an interbasin transfer. We're taking it from one aquifer and we're transferring it to another. So that limit is 3.2 million gallons per day. We're well under that. Then we also have our IMA, our intermunicipal agreement with the city of Framingham, which also regulates what we can transport out even further. And that is actually about 3.2. That's also 3.2 million, actually, excuse me, 2.1 million gallons per day. So those we feel like we're in pretty good shape, except for something known as peak flow capacity. So peak flow happens when you have a peak flow issue. It's when you have a large stormwater event or things of that nature, and it overloads the capacity of the system. The system can't handle that capacity, and you see things like sewers getting backed up, or in extreme cases, and manhole covers coming off. Again, very much in extreme cases. And what we're finding is we're starting to bump up against that limit. So that's also part of the IMA as well with Framingham. And then the last component is really just what our physical infrastructure is, our pipes, what they can hold, our pumping stations, what they can transport. And we currently need to look at what the impact is of all this current development underway on that system before we really make any kind of adjustments. So that's a very long answer to a question.
Yeah, sure.
Which is basically saying we need to evaluate our system, our components to see,
Yeah.
what we can handle.
No, well, thank you for the explanation. Very interesting. I something that at least I certainly don't think about, but it's, you have to plan for that kind of stuff.
Right.
So,
Right.
yeah, thank you.
It's the stuff only DPW directors and town managers think about. Actually.
Yeah, right.
Boring
Yeah.
stuff.
And probably Raj too.
That's true, Raj. Sorry to leave you out on that one for sure.
Little bit of me, so it's all you guys, so, but thank you,
Yeah.
Thanks, Raj.
Any other members with any questions, comments?
I had a question for you, Mike. So with regard to the peak flow, is that the term you used? Peak flow limit?
Mm-hmm.
Are we bumping up against that because of the development in Ashland? Does that contribute to that?
It certainly contributes to it. Another thing that might contribute to it that we just don't have enough information to verify now is groundwater actually seeping into our sewer system. It's called inflow and infiltration. So, that's another contributory factor to peak flow and also your regular average per day flow as well.
Got it. Yeah, thanks.
You're welcome. I just want to clarify, we're not at the place right now where we need to worry about sewer backups or anything like that, just to clarify. But the concern is we don't want to get to a place where we're saying, oh, we should have thought about that and we should have planned for that a while ago. We don't want to get to that point. So that's why we're doing this.
Yeah.
Okay. All right. Anybody else?
I guys have one more quick question. So after, within the 6 months while you're doing this study, what happens if we're close to capacity? What do we do as a town at that point?
Well, we could extend the sewer moratorium. That would probably be the first step to let us design a solution. That would probably be the first step. I couldn't tell you what the next steps would be.
Thanks.
Thank you.
Okay. All right. Mike, thank you. Thanks very much.
All right. Thank you.
We're happy to support as any way we can. So you're as always, you're welcome to stay, but I'm sure you're a busy man and you probably have a lot better things to do.
I've got a couple more meetings to go.
Yeah, I'm sure you do. All right. Thank you for coming on and letting us know.
Well, thank you.
Okay.
Thank you for the support.
Of course. All right. Moving on to agenda item 3. We were potentially considering appointing a Board of Health Liaison to the Ashland Public School Health and Wellness Committee. I thought we had spoken about this a little bit. Did anybody volunteer for this, or?
I did.
You did?
And I thought Jim Adams was going to come on to the meeting too, but I had offered to do it. I didn't know.
Are you sure you have like
on the
a
agenda.
million things to do? All right.
Yeah,
okay. All right. All right. I think if you're going to volunteer, we don't.
Unless anyone else is interested.
Yeah.
No one's jumping up and down.
Yeah, nobody's jumping up. Okay. All right. I guess you're self-appointed. Thank you very much with all your other billion things that you do. Speaking of that, how did you do anything with the clinic today? Were you there?
No, I wasn't at today's.
Yeah, you were probably working. Okay. That's probably out of line anyway. Okay. All right. Ed, thanks very much. As always, for everything you do. Speaking of that, next item, Jay, up for remote area medical update.
Yeah, we have an update. Thanks, Ron. So good news. Finally, we got word from Keefe Tech and from RAM that it is a go, that the venue at Keefe Tech will be suitable for the clinic in 2023. There was the RAM had come out at the beginning of the month to do the inspection. It was very thorough. We went down there, spent about 2 hours going through Keefe Tech, talking to key people on the staff in the facilities department. And the holdup was this kind of a snag, because in the dental service that RAM creates in these clinics, it involves, because of COVID, they need to have individual tents covering each dental chair. And the height of those tents we thought might possibly interfere with the smoke detector system that they have at Keefe Tech in the area that we wanted to put the dental service, which was the only area this was really going to work in. And so there was some back and forth and lots of measurements taken, and the company Siemens that installs the smoke detectors needed to be involved and kind of assess the situation. But finally, we got word that this should work. And so it's a go, and I hope to be busy with that at Berman as well. So that's exciting news. So the next step for the clinic now is really the planning phase. So over the next 10 or so months, we'll meet with RAM on a monthly basis by Zoom. And then as we get closer to the clinic, we've already identified the key members of the community host group team, the CHD team, as it's called. So we'll meet more frequently as we get closer to the clinic. And so that's the status of it, and I'll keep everybody updated. And Ed, I don't know if you want to, I haven't talked to you since you made the presentation to the EMS group, if you want to.
Sure. So everyone, I'm on the board of directors for the Metropolitan Boston EMS Council, and part of the representation of that organization is all the major hospitals in Boston and others, South Shore Hospital, Newton, Wellesley, et cetera. So I did make the presentation that we were going to be hosting this just to kind of get them on board, because we're going to be needing hundreds of volunteers over those days, nurses, doctors, just to kind of put it on their radar screen that we're going to be looking for people to come help us. And it was very well received. Everyone was like, wow. I mean, they were kind of taken aback that we were taking this on, and seemed ready to step up to the plate.
Had anybody ever heard of RAM, Ed?
It's funny, a lot of them did not, which I thought that was very interesting. So I directed everybody to check out their website in the meantime. I kind of gave them a quick overview of what it was all about. And, a lot of them, you could see they were writing stuff down. Obviously we were on Zoom, so I know people were very interested, especially from the major hospitals.
That's excellent.
Yeah.
Thanks for doing that.
That really is. Yeah, how exciting! What a huge undertaking. So thank you both. Just a quick, almost personal thing. I not necessarily personal, but just interested. Do you or does RAM take care of? I don't know what if there's either any type of temporary licensing or permitting, along with liability insurance and things like that. Is that all taken care of by them, or? Because I want to see if I get our state society, involved,
right.
As well. I just want to give them enough time and, or any information. You don't even have to give it to me now. You give it to me off the air.
Yeah. I mean, right. So what happens is all medical providers, dental, medical, vision, that are typically licensed will have their licenses checked.
Okay.
So when a volunteer provider is interested, they'll go through the website portal. They'll pick that particular clinic. In this case, it would be at the Framingham Clinic in 2023. And then automatically you would get screened. They would make sure you were licensed. Now, I told everybody that Lynn, the city of Lynn, is having a clinic. It was postponed until the end of October. The reason that was postponed was because the clinic found out, RAM found out, and Lynn found out that in Massachusetts, in order to set up one of these remote or dental clinics, they needed to have special licensure or a certification, not for individual providers, but for the clinic itself. It could be like that in other aspects of medicine in Massachusetts. We'll find out.
Yeah.
But certainly the individual licensing needs to be in order. You've got to be currently licensed. So that's one thing. And that goes for nursing as well. With regard to malpractice insurance, everybody's encouraged to have their own. And, I'm sure you've got your own. If somebody does not, RAM will provide that, and that would come out of the community host group budget. So what happens between now and the clinic is that we develop a budget to pay for pretty much everything, including putting up people that work for RAM in the area. So the hospitality component eats up a large portion of the budget. Part of that budget will be for things like malpractice, or I should say liability insurance. So that's my mental health hat. So anyway, all those questions would be answered, at the time that RAM interacts with providers.
Yeah.
So at this point, nothing to do right now, unless you wanted to be involved in the planning or steering committee component of it. Yeah. I know everybody's busy, so I don't, want to ask too much of people, but, certainly there's that as well. But then if it just at the provider level, nothing you need to be concerned about yet. And you and I can just continue to talk about how that would work.
Okay. All right. Yeah. That's great. Yeah. Thank you so much for the update.
All right. Ron, you didn't know you were the lead podiatrist. You didn't know that?
I didn't. No,
you've already been nominated.
I'm going to try to recruit, many of my brethren, as many as you need.
That would be great. I've been to a few of these clinics, as you know, and podiatry is a big deal because people don't get podiatry, right? Yeah. So, this is their opportunity, often for the first time with a lot of people. So, I'm sure you've seen that before. Usually
we're a pretty benevolent group, so I'm sure I can get as many people as we need. So,
that would be wonderful. Yeah. So right now, what's going to happen is, as I said, we will start planning. And so it's me, it's Ed Berman here, Steve Mitchell and Ed Hart. We're the core group on the community side. And then we're matched up with a couple people from RAM. And then we work in partnership over the coming months to develop the budget, raise the money, figure out what we need to do, get everything in place. Hospitality, volunteers, venue, logistics, public safety, all of that goes into it. I'll certainly be learning a lot because I've never led one of these things before. So, but it should be good.
Yeah. So huge undertaking. Thank you for the time, Ed, as you as well. Thank you.
Yeah. Thanks, Ed.
Yeah. So. Anybody else with any other members with any questions, comments? No? Okay. All right. Thank you for that. All right, moving on to agenda item 5, the consent agenda. So figured I'd be smart and actually print out at least the first page of the meeting minutes that we're supposed to approve. So I think we should just do those individually because there's 1 or 2 exceptions in each case. So I don't know if anybody else printed them out, but if anybody wants to make a motion to, let's say, if we start with the July 19th meeting minutes, it would be everybody except Bernadette, unless she feels comfortable voting on that, if she's either read the minutes or watched the replay, the video, which probably nobody has done, but that I would just do these individually. That way we don't have to kind of guess. So anybody want to make a motion to, to accept the minutes of the 19th meeting?
Yeah, I'll make a motion to accept Ashland Board of Health meeting minutes for July 19th.
Okay. Anybody second? Ed's going to second.
I'll second.
Okay, so Ron.
Aye.
All in favor? Aye. Okay, sorry. Okay, that's 3. And Barbara, you were there as well? You good with that?
Yep, aye.
Okay.
Yeah.
Okay, great. That passes 4-0. Do the same thing with the 25th. It was Bernadette, Ed, and I were in attendance. So, Ed, you want to make a motion?
I'll make a motion. We accept the minutes from that meeting.
Okay. Bernadette, you want to second that?
I second it.
Okay, great. And we'll vote on that. We all agree that those are good. Aye, Ron.
Aye.
And okay, great. That passes 3-0. And the same thing for the last. That is the September. No, oh, here it is. Sorry.
August
The
23rd.
August 23rd. And everybody was present for that one except Ed. So anybody, Barbara, John, or Bernadette, want to make a motion to accept the August 23rd meeting minutes?
Yep, I'll make it. Go ahead, Bernadette.
I would like to make a motion to accept the August 23rd meeting minutes.
Terrific. Second?
Second.
John seconds. All in favor? Aye.
Aye.
Yep. Okay. All right. That's great. All right. That was pretty good. All right. And I guess if everybody has reviewed the year-to-date budget, I just had one question, Raj. I just happened to be looking at the revolving fund for the tobacco, which is about $24,000. And is that just because it's just in September that none of that is used, or is that will that get used, or is it different now that we're in a consortium with the other towns?
That is correct, sir. From almost a year and a quarter, right? We are not using that money, but we do have a grant till just July 23. So this year we got it, but we don't know in future what's going to happen. So we're just going to still hold the money. We might have to hire somebody or pool money moving, after July 23. Till then we are good, and I don't think so there's going to be any expenditure, but past that we are not sure at this point.
Okay. So what does that just go back in our pocket? Does that go back to the town? How does that work if we don't use that?
There are limits on it, so like the amount of money we can hold in those particular accounts. Okay. I will check if the tobacco one have it. I guess the food one is $50,000. That we can keep. If over that money goes to the general fund. But I'll check on the tobacco. But as of now, but I'll update the board. What is the limit on the tobacco revolving? But if we go over that limit, it'll go to the fund. But otherwise, it'll stay with us.
Okay. All right. Great. Right. Well, thank you. Okay. Anybody want to make a motion to approve the year-to-date budget report for fiscal year 2023?
I'll make a motion that we approve it.
Okay. Thank you, Ed. Any seconds?
I'll second it.
Okay. Terrific. Thanks, Bernadette or Barbara. All in favor? Aye.
Aye.
Okay.
Aye.
Aye. Okay. This is 5-0. Thank you. That was relatively painless. On to the item 6. Raj, you're up.
Thank you, sir.
Yeah.
First on COVID-19, we did have a COVID clinic, bivalent booster clinic today. We did a total of 43 doses. Thank you, Dr. Ron, for signing the standing order. Even I appreciate all your support.
You're welcome.
Mr. Berman, we was checking the data today. We have actually done 1,650 doses of COVID vaccines in Ashland from the time I'm here, so that's only 15 months, most of that was done by Mr. Berman, but, it was fascinating to see that till today, from May 2021, when I came on board, we did like 1,607 doses, and we did additional 43 today, so like 1,650 doses, in the last 15 months, so.
And Raj, don't forget that number does not include what we administered in.
Oh, absolutely. Oh, no. This, yeah, absolutely.
That was just in downstairs.
No, those are like different numbers. But we had a discussion today. Like, I had a discussion with Mr. Manager, and we just wanted to look at the number. And I ran through the MMIS system, and I was surprised, numbers are huge, at least from my side, so I just wanted to update the board, so we have still, we consumed eight vials of the 20 we got for the new bivalent, we'll be putting some more clinics together for the same new booster. Monkeypox, the cases, we have not seen anything new around us, here, but the US in total, we have like 23,893 cases so far for monkeypox, orthopox virus, and Massachusetts have 374 cases so far. We're doing great with the childhood vaccine program. We have one scheduled for tomorrow. So far, we have administered 189 vaccines, for the childhood vaccine. With arbovirus, the state of Massachusetts has 4 cases this year so far. 3 of them are in Suffolk County. 1 is in Middlesex. Hopefully, this number stay low. 91 positive water samples, for West Nile so far. And I don't think so we have seen anything for EEE, nothing for water samples or any case.
I know it was hot, but I'm still shocked by how low those numbers are. I don't think I've ever seen it lower.
Right, so yes. And I guess the drought have played a major role here, but we are just great, that West Nile, is bad, right?
Right.
Even the neurological component, so. But I'm glad, the numbers are staying low and there is nothing around us.
Yeah, I mean, a few years ago, we had to kind of ban outdoor activities for the high school kids, in the fall because of the EEE. So.
Right. Yeah. I mean, we still have a couple of months, I guess, on this still, usually till the second hard frost, there is a risk, but hopefully this stays low,
Yeah.
10 Saddle Hill Lane, we've been working with this property for 3 months now, Unfortunately, they dig a new well on this property, but they still have water issues, this is according to the property owner. And at this point, town is also looking, if there can be a possibility of a municipal water there, but it's almost 3 months, they have this problem going on. But the water, the wells went dry. They have one well, and then couple of weeks back, they drilled another one, we did give them a permit, but it seems not too much luck there, I'll keep the board posted on, but it's a little complex situation right now, and it's up on a hill. It's tough, if the municipal water have to go there, the DPW and the team at the town hall is working on it. Item E, we have, sorry, please. Anybody have a question? No, right? So we have granted another permit at 14 Vine Sap. This is the irrigation well, just want to update the board. And item F, Dr. Ron, I guess, this was from the last time.
Yeah.
If you want to see if any board member want to,
Yeah, I was, if I can go, I will. I don't know if I'm going to be in town that weekend yet. So, we can certainly review it in a couple weeks, but I mean, if anybody can, I will go if I'm here. I will certainly know in 2 weeks.
And the other thing was like we have to nominate one of our board members, right? Like, it's yourself and then one more member. If somebody wanna be on the board there, at least our representation, from the Board of Health that decisions are returned.
I have to check my schedule because the problem is it's during because the 14th is a Friday, isn't it?
That is correct.
Yeah, so I'll try to, let me see if I can rearrange my schedule at work.
When is the retreat to take place?
At the middle school.
Oh, that's the venue for the retreat?
I think that's what, if I remember very well, right, Raj? Is that the middle school?
I am not sure. I can check. It might be at the community center, but I'm not sure. I'm sorry, but I will check,
Okay.
I think I can attend the retreat. I put it on my schedule.
Okay.
No, that's great, Bernadette, if you can do that, and
yeah.
I don't know if you wanna keep the other thing pending about a representation, like in, I don't know, Dr. Ron, how you wanna proceed with that, but.
Yeah, I'll have to see what my, like I said, I don't know if I'm gonna be in town. I can always, and I have to see if I have any cases scheduled that day, but I might be able to move around a little bit in the morning, since it's a few hours. So like I said, I'll be able to let you know. I'll be able to let you know by the next meeting.
Sure, sir. Yes.
Yeah, I wouldn't be able to do it on a Friday like that, but do you need 2 people from the board or is
no, sir. Representation permanently, like there was 2 members earlier. It was Dr. Ron and Diane, because Diane is not here. It's not for this retreat. I'll definitely be there and represent the board there. But whichever board member can join there, that'll be great. I'm just asking in general, right? Like, in
general, I still like to do that. So I'm all in for that. I thought you just meant for the retreat, but I can certainly see if I can make that. But I still like that. I know Kristen and they do a great job. I enjoy, listening on their meetings.
Right, sir. But I was asking in addition to you, there can be another board member.
Well, it sounded like what Bernadette or Barbara was going to check that out. So
sure.
To see whether or not anybody can do it. Well, actually, Diane kind of gave that up when she was, the chair. So I used to go to those meetings at least before COVID, just because they were pretty easy to get to. But a lot of times they run their meetings concurrent with ours, and ours have to come. It seems like that's the way it's been, lately. So we always unfortunately have to, or for whatever it is, we have to, deal with our board first before we can do that. So hopefully that will change where they don't run those meetings, basically on the same times that we have our meetings.
So that'll be great, sir. Yes, and I will love to hear from Barbara, Bernadette. Please, keep me posted.
Yeah. Okay.
Thank you.
Okay.
Sorry.
Laura, go ahead.
8:30 to 11. The retreat is on the 14th at 8:30 to 11 at the middle school.
Middle school, sure, yes.
Yeah, I will attend the retreat.
Thank you, Bernadette. Yes, thank you. Item G, House Street landfill. So we've been working on this for like a couple of months, maybe a little more. What we are trying to do, and we have filed an application with DEP right now. That earlier we've been asked to monitor this landfill on a monthly basis. That we have a contractor called EnviroTrack that they do sampling and all that for us. The numbers was low and it's a good cost to us. So we have asked a DEP, we have filled an application through EnviroTrack to do that from monthly to a quarterly. I did had a word with the DEP inspector. He kind of, verbally agreed to it, but we have an application in, hopefully they approve that, and it'll financially it'll help us, that'll reduce our cost to almost half. I guess we've been spending $15,000-$16,000 every year on this. It'll come to like 8 or 9, somewhere around that ballpark.
So the former company was what, Amoresco?
So I guess that was the company, but from the time I'm here, we are with EnviroTrack.
Okay.
I guess last 3 years was EnviroTrack, and then we extended 1 year, and now this year again we extended with them for 1 year. But
okay.
So we're trying to get on a quarterly monitoring schedule. Hopefully DEP approves us. We'll keep the board posted on that.
Okay.
Chestnut Place Apartments, we do had like a trash issue going on, because their dumpster, is all time, like they are not maintaining the dumpster. There are like 200 apartments there, maybe it's the capacity issue, little complex given that, we had like over past year, 4 or 5 complaints of rodents, they're like mice, I had another complaint last week, and I have to order a second citation for $100, at the apartments. We're still working with the management to solve it, but it's like an ongoing thing, It's just like going for at least 6-8 months, So keep the board posted on this, Hopefully the management have changed, the managers, like there is a lot of new managers, like their turnover is so much, but there is a issue going on with the trash, and because of trash, there are rodents in the complex.
So it doesn't seem like they're that motivated to try to take care of this quickly, if it's 6 to 8 months already.
Right. So in between, we got some compliance, given the management change or the managers changes, it falls back kind of, So I did had some improvement in between, but it's just like, and we in Ashland itself, we have an issue of illegal dumping, the outside folks coming and dumping at these complexes, like contractors and all that. I don't want to name, but yes, it's a complex issue, the police involved, like the department, So with at least illegal dumping, when Mr. Berman was here, we was trying to look, like install cameras at our parks and all that, right? I mean, so they still like, the units are saying, or the Chestnut Place Apartments are saying that they have a lot of illegal dumping, but still like their responsibility from the port side, But I just wanted to bring it to your attention, that like, hey, this is going on and we're dealing with it.
So what other kind of mitigation techniques do they say they're going to try to undertake to take care of the issue, or don't they even discuss that with you?
No, I had a good conversation with the new manager yesterday, because last Thursday, I have sent in citation, they received it, and given the new complaint, I have to call them anyways to discuss that, they're ready to work with us, I guess they got some patrol agency also to see, like, people who come dump after hours and the management probably is not around or something like that, They're thinking to install CCTV cameras, but I've been hearing this for like past 6 months, So,
I don't know any other way. Nobody's going to come forward and identify anything. That's going to be the only way to do it.
Yeah, and I don't know. Like I know most apartment complexes have like a camera around the dumpster. They don't have something like that.
Right. No, not currently. And they was looking into it, I guess this just like maybe a legal issue installing cameras, that you have to maintain it if you do that, something like that, I'm aware, but irrespective, they have to solve this, whichever way they do, I mean,
Yeah.
to my understanding, again, this is what I've been told, like there are two people who maintain this property. And I feel that that's very low number given 200 units, like that's like one person for every 100 units, so for the maintenance crew,
Yeah.
But in a week or so, if we don't find solution to this or they don't comply, I mean, I'll definitely bring them in front of board and, who can have a better discussion here. But I just wanted to, at least for right now, and I'll keep the board posted, that this is going on. My next item, Dr. Ron, still reviewing the regulation. I know I have couple of, regulations I've reviewed. I'm working with the town of Salem. The director there is also trying to put a new regulation for body art. Hopefully I have something for you to review soon, but I'm still working on it.
Okay.
Other than that, I have a couple of conferences coming, that I'll be attending. I have my MIHA conferences end of this month and the amateur next month. Just wanted to keep the board posted. And I'm open to any questions now.
Nobody? Okay. All right. Raj, thanks. Very thorough report as usual.
Thank you.
Yeah, moving on to agenda item 7, the reorganization of the board. If all members are present, we finally are after, oh my God, what? 4 months almost, I guess it's been. So that's good. I guess everybody's kind of busy. So I'm certainly happy to stay on leading the meetings as long as everybody would like me to, but that needs not a majority, of everybody to vote for me to do that, which I'm certainly happy to do. So if anybody wants to make a motion for that, we could at least get that part out of the way, and then we can do the vice chair and the secretary.
I make a motion to vote Ron in as the chair of the Board of Health.
Okay. Anybody want to
I'll second that.
Okay.
Yep, I'll second
All in
it.
favor?
Aye.
Okay. Second, thank you. Aye. Okay.
Aye.
All right. Looks like that passes unanimously. So, okay, not a problem. It's already there's only a third, 2/3 left anyway at this point. I can't believe it's 4 months already since May rather. Anybody interested in the vice chair, which typically we'll run them if I'm not here. That's pretty much the extent of that job for the most part.
I would be willing if no one else wants it.
Thank you, Ed. Does that mean I can actually make a motion? You're going to make a motion? Okay, go for it.
Okay, I make a motion to nominate Ed Berman as the chair of the board.
Vice chair.
Sorry,
Vice chair.
Freudian slip.
You second that? Terrific. Thanks, Barbara. Okay, I'm in
That was
favor.
Bernadette.
Everybody. Oh, Bernadette. I'm sorry, Bernadette. Yeah. All in favor? Aye. Everybody's playing music. Okay. All right. That's great. Ed, thank you very much. I hope that you never have to do anything, at least for the next 8 months. So for that, I will plan on that. And the secretary, anybody want to volunteer for that?
Well, I just have a question, Ron. So I was saying, I wanted to find out. So it's only for 8 months at a time?
No, it's for the year, but we're already 4 months in. So there's only it changes every year. So some boards work it. We have never done it this way that we pretty much have an open vote, but some boards work it. You kind of work your way up. when you're the vice chair the following year, or whenever that term for chair is up, that you would become the chair, and we've just worked it, whoever kind of wants to do it, kind of thing. So there's, the secretary really doesn't have to be involved that much, so it shouldn't take, really almost any effort. Not that this takes a ton either, but if we just need to fill that position. So anybody like to do
what
that?
What does the secretary do besides?
I think basically in extreme emergencies, you would have to lead a meeting if there were still a quorum of people and both me and Ed were out. And then I think the only thing I did once when Laura couldn't do it was I actually did minutes for one meeting in the 5 or 6 years I've been on the board. And Laura is way better at it than me. And
I remember that.
She does a wonderful job with the minutes, but I felt like I was back in medical school when I would basically get tapes when we had note service and try to do that. And so Laura does a wonderful job of doing that. And that's probably never going to happen.
So Laura, pretty much you do the schedule for us, right?
Yeah.
The minutes, the agenda.
The minutes.
Oh, okay.
Yeah, Laura puts all that together.
Yeah, Clerk can just, be available to help in, capacity.
Okay.
Right.
With that being said, I nominate Barbara as the secretary.
All right.
Yeah, exactly.
All right. Barbara, thank you for volunteering. That's so nice of you. Anybody want to second that?
I second it.
Okay. All right. We're going to let that go. I'm going to take that. And in case Jay's going to second it, just in case that's not legal.
I'll third it. Yeah.
Okay. Jay's thirding it. Okay. Anybody in favor of that? I'm in favor of that.
I am in favor of that.
All right. Thank you.
Who was the secretary? Who is the secretary?
Right now it's Barbara only, so I mean, I guess it was
prior to this.
The secretary before.
Yeah.
That's correct. Yes, it was Barbara only, I mean.
Yeah.
I guess we word the position as clerk, or secretary, but like it was Barbara only,
Clerk. Yeah. Right.
Yeah.
Clerk. Okay. Sorry, I misspoke. Okay.
That one comes
Nobody will sue us for it. Okay.
Okay.
Okay, so on to agenda 8, the future meeting topics. And I know, Laura had sent me a little thing, regarding the relatively recent ruling, by the court system that there's basically not quite a quarter of $1 billion or a $500 million settlement for Juul. That I guess a lot of different states are going to get some money for that. Ed, do you know a little bit more about that? Or Raj, you probably do. No. So, I guess, we've always been relatively on the forefront of these things. So I think she had an email from or a phone call from John Featherston, who did a lot of work on this as well. And, we all know that, Diane Mortenson's mother-in-law did a lot of things for smoking. And, we passed some regulations ourselves recently, to try to ban flavors and, at least keep it out of the, kids as well, hands, as well as decisions at every turn doing, all their things. So we will, Laura's going to, set up invitations, and we'll have a little recognition of that, at least at the next thing. And I don't know if anybody else has anything urgent that they want to talk about. We'll keep Jay on the agenda, and I'm sure there'll be something else by the time a couple of weeks rolls around.
Hopefully.
Yeah.
And it might be Dr. Ron, as I mentioned, and couple of board members knew we have posted our public health nurse position,
Okay.
We do have a couple of potential candidates, and we are working on it. So hopefully we'll have something, and I can update the board next meeting.
Okay.
But we are working on it currently on the 5-hour public health nurse position that we have in the department.
That's great. That's exciting. So,
is that the same one that I saw? It was like 5 hours a week.
That is correct. That's what we have currently. For our public health nurse, we have 5 hours position in the department. Yes.
Okay, so I think that's a tough one to fill.
I know, 5 hours a week.
Yeah, 5 hours a week. So would they be working like just 5 hours straight, or do they spread it throughout the week?
Right, but like, it depends, so we kind of working on that, probably just to do like, communicable diseases and all that, and it can be after hours and all that. We'll see, like, that's what we'll be discussing with the candidate. We have interviewed one, and we'll see, like, it can be, we can use those hours for a COVID clinic, It'll depend. We'll definitely have some flexibility here, given, we are not going to find, like, if we put a hard line on it, like that, hey, we need person only this hours and this day, it'll be tough, given what's happening, in the whole sector, like, they're very hard to find public health nurses right now, We, at the shared services, we have 2 positions vacant, right now. That's like 19-hour per week positions. There are 2 of them, for the grants we have, like with the shared services. So there are 2 positions there, 19 hours each, that's sitting there for like 6 months, I guess, that we are not able to find a candidate. So. But if you have any referrals for that also, then the positions are out of Hudson, I can send you guys more details, but if you have any referrals, somebody who can do that, we'll appreciate that.
Yeah. Okay.
Thank you.
Great. So I guess the next scheduled meeting would be on Tuesday, October 4th. Right. Anybody else with anything else? No? All right. The most important motion of the night. Anybody want to make that?
I make a motion that we adjourn.
Okay. Second?
Second.
Okay. That's great. All in favor? Aye.
Aye.
Right.
Aye.
Okay, everybody, thank you very much. Good meeting. Raj, thank you, for everything as usual. Ed, you too. And Jay, for everything you're doing. And, Bernadette and Barbara, you guys are great as well. So, and Laura, thank you. We will see everybody in a couple of weeks.
Thank you so much.
Bye. Have a good evening.
Yeah.
Thank you.
Good night.
Good evening,
Thank you.
everyone.
All right, good night.